8:15, Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, normally joins us on Thursday, but we're going to be at the Radiothon for Children's Hospital on Thursday, so he joins us today. Morning, Dr. B. How are you?
Hey, Tommy, I'm doing great. How about you?
I am fine, thank you, sir. Medicare's annual enrollment period ends this Thursday, December 7th. Today's the 5th, but if you do want to change your Medicare coverage for 2024, you still have a chance to do it. Dr. B from People's Health is going to explain Medicare's star rating system, the 5-star special enrollment period. Let's get into it, Doc. What are star ratings?
Yeah, sure. So every year, Medicare actually uses their star rating system to really measure the quality and the performance of Medicare Advantage plans. And so all eligible plans are rated on a scale from 1 to 5 stars, and the better a plan performs, the more stars it gets. So it's a really an easy, unbiased way to compare plan to plan, and those results are released each fall. Ours just came out about a month or so ago, and they apply to the coming year.
And I know that you guys have a 5-star rating because we've discussed it before, and that's some pretty rarefied air.
Yeah, definitely. And it's actually the third year in a row that most People's Health plans earned 5 out of 5 stars, so the highest rating that Medicare awards. And it's actually the 7th year in a row that we've earned the highest rating in the state. And so for 2024, we're actually the only Medicare Advantage organization that is offering 5-star plans here in Louisiana.
Sounds like you must be doing something right. How does Medicare determine a plan's star rating? How did you earn those 5 stars?
Yeah, so it's pretty complex. Medicare Advantage plans that also include prescription drug coverage are evaluated every year on about 40 quality and performance measures. And what Medicare is really doing is they're looking at how well a plan connects its members with preventative care, which is so crucial, but also how it helps members manage their long-term health conditions. And it also looks at whether or not we are providing safe and cost-effective drug coverage as well. And so for all of these measures, it's a lot of data that Medicare looks at to determine these ratings, and they get a lot of it from things like electronic health records for the patients and medical claims that doctors and hospitals are submitting to get payment. But some of the most important measures, those that are really related to the member's experience of the health plan, Medicare really goes straight to those individuals and surveys them to get the results, kind of what they're feeling about their experience.
Well, what is that experience-related measure? How do they do that?
Yeah, so what Medicare does is it asks plan members about their overall satisfaction with the health plan. They ask them questions like how easy it is to get care when they need it. And if they do need to appeal something, if they're denied something and they need to appeal it and they have to go through that process, does that happen in a timely manner? Are there any delays to care? And then also, how helpful is the plan? If you need to call them and talk to somebody in customer service, are they really helpful, in getting you what you need? And the measures related to member experience have a really huge impact on the star ratings, actually higher than any other category. Over a third of the entire star score is related to those member experience measures.
You mentioned the only one in the state. I would imagine achieving the 5-star ratings kind of difficult.
Yeah. 5-star plans are really top-performing plans. It's the ones that Medicare considers excellent. It's really not easy. In fact, it's something that, the entire organization is working on day after day. And really about less than 6% of all Medicare Advantage plans are rated 5 stars for 2024. So obviously we're extremely proud of this 5-star rating that we've been awarded.
On a quick break, we'll come back. We'll talk about, there's a saying, you get what you pay for, but maybe 5-star rating plans are not necessarily more expensive. We'll talk about that with Dr. B. A quick note, you can join Newell Norman out at the People's Health Medicare Center, 3017 Vets in Metairie. He's going to be out there today, live on location from 10 until 1. He'll have a great show planned, but stop by, say hi, see everything they have to offer for you out there, especially if that deadline is looming on Thursday, December 7th for you. More about the 5-star differentiation when we come back. 8:20 Traffic Now, WWL. 825, Tommy Tucker, WWL, talking to Dr. B, our friend, Dr. Brent Wallis, Chief Medical Officer of People's Health. Newell's going to be out at the center, the People's Health Medicare Center, 3017 Vets in Metairie, right next to Party City. Nice facility. We'll talk more about that later on. We're talking about People's Health 5-star rating when it comes to Medicare Advantage programs. The only one in the state and one of only 32 in the country, right, Doc?
Yeah, that's correct. That's why we're so excited.
But are they necessarily more expensive 5-star plans?
Yeah, not necessarily. You know, the cost of a Medicare Advantage plan is determined by a lot of different factors, and it's really not the star rating that determines that. So it's very possible to enroll in a 5-star Medicare Advantage plan that really does connect you to those cost-effective healthcare services. You know, People's Health has multiple 5-star plans in the state that have a $0 plan premium and no annual deductibles, so very affordable plan.
What does that mean, premium and deductible?
Yeah, so a premium is the fixed amount that you're going to pay to the health plan in order to get your coverage, and it's paid on a monthly basis. So some plans may have a monthly premium that you have to pay. And then the other part is the deductible. So a deductible, if your insurance has one, it means that you have to reach that deductible by paying out-of-pocket costs before the health plan is going to kick in any money. So, again, we have plans that have $0 premiums and no annual deductible at all.
Can we presume the 5-star plan is always a better option?
Usually it's a very good choice to make. You know, high rating shows that the plan has really satisfied members, so they're happy about the care that they're getting, and it provides great customer service. But everyone has a lot of different needs, so I say this a lot. No health plan is really one size fits all. You know, that's why you have to do your research. A higher performing plan may not be good for you if, for example, your doctors are not in their network or your hospitals aren't in the network, or if your prescription drugs aren't covered, then that's not a plan you want to go with. And if it doesn't have the extra benefits that you need and that you'll use, things like vision and dental coverage. So you have to really research and think about everything.
And you didn't give yourself 5 stars. People's Health didn't do that. That goes to how people can find out about a plan's star rating.
Yeah, the best thing to do is go to Medicare.gov, and they've got a great plan finder tool on there. You just put in your zip code and a few pieces of information, and they'll tell you all the plans that are available in your area. And if it's a 5-star plan, it's going to have a little gold star icon right next to the plan name. Likewise, if it's a low-performing plan, it's going to have a red alert symbol. And if you don't like the Internet, you can actually call Medicare, too, 1-800-MEDICARE, and they'll tell you about the star ratings and what plans are available to you.
Are there some without ratings?
Yeah, there are, and typically if your plan doesn't have a rating, it means that it's too new to be rated. So you want to, like we were talking about, all those star ratings are based on members' experience and the chronic care management. And so if a plan has only been around for a short period of time, there may not be enough data to really draw a conclusion about its quality.
5-star plans carry with them different enrollment options come along with them, right?
Yeah. So like you mentioned, Medicare's annual enrollment, is the big period where everybody should review what they have and what they need for the next year, and that's ending on Thursday. But outside of the annual enrollment period, you usually need to meet some sort of criteria, like maybe you moved outside of your area or you lost Medicaid coverage. But a 5-star Medicare Advantage plan can actually enroll starting actually on Friday, December 8th, and all the way through next November. That's called a 5-star special enrollment period. And Medicare beneficiaries can actually make a one-time decision to switch to a 5-star plan.
So that means, although the deadline is on the 7th, Medicare beneficiaries can enroll in the 5-star People's Health plan year-round, basically.
Yeah, you get an extra chance. So, so if you're not happy with the choice you've made or the coverage that you have in 2024, you've got until November to, give People's Health a chance. Give us a call. we can tell you about that 5-star plan and what the eligibility requirements are for it.
And I mentioned Newell's going to be out there. I presume you're going to be out there with him, or at least visit the People's Health Center at 3017 Veterans in Metairie, next to Party City. I know nobody hard sells anybody, no hammers dropped. And you mentioned that 5-star plans might not be the best for somebody, and that's what you guys do out there, right? That's what they do. They sit down, they say, what medicines are you taking, what doctors do you see, and then they help you evaluate?
Yeah, and really look at all of your different options. Like you said, it's definitely not hard sell. It's a lot of really fun people. I know they're probably going to have some donuts out there and some coffee. So definitely come by and see us. You know, you can just walk right in, and like you said, Newell will be there too.
And the walk-ins are welcome. You can make an appointment if you like as well, but I would hurry up on that because the deadline's December 7th, right?
Yeah, absolutely. Get in while you can.
Thank you, Doc. Appreciate your time, and tell Newell hi for me.
I will, and you have fun at Children's. I spent a lot of nights there. It's a wonderful place.
Thank you, sir. I appreciate it. It really is a wonderful place. You can explore, find out more about People's Health at peopleshealth.com. You can follow People's Health on Facebook and Instagram. And go see Newell today. He'll be out there from 10 to 1 at the People's Health Medicare Center in Metairie, 3017 Vets next to Party City. Appointments are okay, but walk-ins are welcome. And now, considering the deadline is so close, you might want to go and be a walk-in. 8:31, time for WWL First News. For that, we go to Dave Cohen.